Good morning, everyone. We will get started in just a minute. We've got more people logging in. Welcome to our May Community Cafe. Feel free to turn your cameras on, or if you need to, leave them off. And as we go, if you've got questions, you can put them in the chat box or raise your hand or come off mute after our speakers have gotten done. And feel free to ask questions as we go, but we'll give it a few more minutes. So we're going to get started. I see Kathy's still connecting, but I feel it's important to keep on our schedule. Welcome to our two partners May Mental Health Awareness Community Cafe, where we will be focusing on maternal mental health. Thank you all for joining us, and please note that this will be recorded and posted to our YouTube site for those that were not able to make it. So our first speaker today is Amani Pegues. She is the health educator here at Partners. Welcome, Amani.
Thank you, Jerry, and thank you everyone for being here. I am going to share my slides and we will go ahead and get started. So hello, everyone. As Jerry stated, I am Amani Pegues and I'm the health educator with Partners. And today my topic that I'll be covering is the 8 dimensions of wellness. And when I was preparing for this presentation, at first I kind of hit a little bit of a block. I didn't really know what to talk about because I feel like the 8 dimensions of wellness is something that is pretty well known. But I'll frame this as the 8 dimensions of wellness, a reminder. Because when I was putting this together, it was a great reminder just thinking about all the aspects of wellness and why it's important and why we should strive to have it in our lives. So, just as a foundation, the physical and mental wellness link. As a health educator, a lot of the work that I do is centered around physical health. So, as far as making sure that the body's moving, getting exercise, nutrition, and things like that. But when I came to Partners, I realized the strong connection that our physical health has to our mental health, and realizing that whenever we aren't feeling well mentally, it can really wreak havoc on our physical health. So, being able to go out and go for a walk or planning nutritious meals, and vice versa as well, whenever we're dealing with things like poor physical health conditions like diabetes or chronic disease, it can really impact our mental state as well. So, just realizing this strong link and this connection between the two, it just sets the groundwork for starting out with our wellness. So for whole person care, a lot of you have probably heard the term, and this is just the approach that a lot of health systems are moving towards. If you're knowledgeable about tailored plans, you know that that's beginning July 1st. And tailored plans is looking at whole person care. So for partners, we have mental health, but we'll be adding physical health, vision care, pharmacy. So really speaking to that whole person care. And this is important because it realizing that all of these aspects of health, um, it's important to address all of these needs to make sure that the whole person is being cared for. So, connecting all of that to the 8 dimensions of wellness, 8 dimensions of wellness can be just used as a framework to understand whole person care and um, going beyond just the physical and mental health link. So, we'll look at each aspect and keeping in mind just our observances for this month, Mental Health Awareness Month, and also Maternal Mental Health Awareness Month, I wanted to describe each aspect of the wellness wheel, um, just with keeping those in mind. So, when we think about up at the top, emotional wellness, this is really having the skills to cope with the normal stresses of life and really being able to manage and identify your emotions in a healthy way. So, for an expectant mom, this might look a little bit different because when you're going through just pregnancy and postpartum, hormones are going all over the place. So, really being able to identify mood shifts and being able to address those needs. For spiritual wellness, having a set of values, principles, and beliefs that are important to you. For expecting mom or new mom, this might look like spiritual practices that they do just in preparation for their baby, spiritual practices that they want to do during their delivery time. Intellectual, so having a love of learning, just lifelong learning with whatever you're interested in. For a new mom, this might look like childbirth classes, learning about breastfeeding, learning about resources in your community. For physical health, so like I talked about in the beginning, getting exercise, nutrition, healthy healthy habits such as adequate sleep. And for a new mom, this could look like exercise that's appropriate, also getting nutritious meals and prenatal vitamins as well. So for environmental, we think about just within the environment that we live in. So clean air, clean water, just a clean space that we're living in, clean environment. It's the same for expected mom. So uh, also, I would add to expected mom with environments is baby proofing. I know that's just a very big stage that you have when bringing a little one to your home. It seems like everything becomes dangerous. So, baby proofing is very big for environmental. Financial, so being in good financial standing, having resources to learn about finances and being financially literate. And for a new mom, this could be planning financial resources as far as adding a new member to the family. Occupational, this can be within your job or it can be volunteer work, it can be the work that you do at home, but really finding what your purpose is within the work that you do, purpose and meaning. For a new mom, added layer to that could be finding a healthy balance between work and in their personal life. So going through pregnancy, it is moms that actually have to work throughout the entire time of their pregnancy, um, just because they want to have enough time to take off after that baby is there. So just getting a healthy balance between work and personal life. Social, so having strong support systems, strong connections within your family, within your community. And for expectant mom or new mom, this can look like just having strong connections to your partner or your support person and being able to lean on those people whenever you're experiencing hardship. And it's interesting because with the 8 dimensions of wellness, I've seen some models to where digital and cultural wellness has been added to this wheel as well. So thinking about the time that we spend online, just making sure we're uh, having healthy limits as far as how much we spend online, and then also what type of material that we're consuming as well. Because some stories that we come across can be really tragic and graphic. So just realizing how the information that we consume digitally, how it can impact us and our mental health, and then also cultural wellness. So, being able to have an identity with your culture, and also being able to have cultural expression as well. And for a new or expecting mom, this can look like culturally responsive care to where healthcare providers are responsive and respectful to your culture, to your cultural practices as well. So that is our 8 dimensions of wellness. And I actually, with the trainings that I provide, one of the trainings that I do is maternal mental health. So this is the training that goes through various maternal mental health conditions. And then we talk about maternal mental health through the scope of social determinants of health. And then we look at each level, starting at the individual level, interpersonal level, and then up to institutional and public policy level. Different things that can be done to ensure that maternal mental health is being championed within our communities. But I would like to just share a couple of slides from my maternal mental health training. And this training is usually a 2 hour long training. But just to share some highlights from the maternal mental health training, this is the rates, the data that came out for the leading causes of pregnancy related death from 2018 to 2019. And this can be found in the North Carolina Maternal Mortality Review. And I wanted to share this because in the previous report that came out, if you can see, mental health conditions is listed on this chart as the eighth leading cause. This was for the first maternal mortality review that was done. And for the most recent, if you see the shift and you notice, mental health conditions for pregnancy related deaths has risen to the number one spot. And I ask a lot of times within my trainings, what do we think is the cause for this? A lot of times I get responses like COVID, the opioid crisis, and things like that. And it's actually true. Within the report, mental health conditions are counted as opioid deaths. That have been confirmed that the mother had a mental health diagnosis preconception. So the mom had a known mental health diagnosis, and they were able to confirm that the mom was dealing with mental health conditions whenever she lost her life. So it is very important just whenever we highlight mental health and mental health, maternal mental health awareness, that we realize that it is very important to make sure that people are being connected to resources, that they're aware of the various mental health issues that can arise during pregnancy and postpartum, and just making sure that we are identifying these issues whenever they come up and connecting people to resources. So I will stop sharing. Um, that is what I have for you all. Um, I look forward to any questions that you all have and look forward to having the conversation. Thank you.
We'll pause just a moment. Are there any questions for Armani on the 8 dimensions of health and how it relates to maternal mental health? Um,
Amani's Marlene. Um, I would, because we have twofold. We have staff members that could use this information who are new mothers. We also have sometimes students who we support and help from high school or sometimes middle school who are pregnant. How can I get that type of information to our students, especially those 8 dimensions and the way that you spoke about each one, and then you provided specific examples of how that connected to someone in a maternal state or pregnancy state. Is there any additional like support resources that we could use for those students? And would it be okay for the students that we have for them to hear from you in a more intimate setting where they can hear these kinds of things? That's my question.
I would say absolutely. So the training that we provide, the 2 hour training, we're able to come out and do it within the community in person. We can do it also virtually as well. But I would say it would definitely be appropriate just for those expecting parents. And then even if students aren't expecting, just being knowledgeable of these conditions, because these are things that they may experience sometime within their lifetime or know someone to experience these things.
Thank you, because just every time I'm on one of these sessions, there's something else that I can connect back to our school system. And we hugely try to support our expectant mothers, whether they're teachers or students, but hugely our students because they need it. So I definitely am going to write that in for my proposal coming up about supports, seeing how we can get you guys in to work with our students and make it open for any student, but I think really make it more intimate for our ones who are already pregnant.
Definitely. Thank you.
Thank you, Marlene. And I love to see you holding that cup of coffee because that's the whole thought of a casual conversation with some really important information. While you have a cup of coffee, maybe some water, maybe breakfast. Are there other questions for Armani related to this 8 dimensions of health and maternal mental health? All right. Thank you, Armani, for a great presentation. And she'll be available later on if you think about something you need, or feel free to put it in the chat box. But we're going to move on to our second speaker, and that is LK Johnson. She is a mom for a 25-week NICU baby and former ambassador for March of Dimes. And I told her that all the other things she's got going on, I'm gonna let her speak about those because I didn't want to mess it up. I want to make sure I respect and let her do the important stuff. So welcome, LK.
Thank you so much. Thank you, Jerry, and good morning, everybody. I hope you're doing well. I am so honored to speak and to share our story. I am, as Jerry said, I'm a proud mama to a 25-week NICU veteran. He is now 3 years old and doing well. He is thriving and pretty much my inspiration for everything that I do in life. Amani, thank you so much for your presentation. I'm so glad that we summed up in the end of your presentation the way that we did, because the whole theme to what I was going to speak about today. I'm going to tell you about our story and our journey. And what I really wanted to emphasize is when I tell you that I literally had all the tools. I had all the tools, all the resources, all the community support, um, you know, level of education, college degree. Like when I tell you I had all the things set in place for this to be perfect, and it wasn't. And I'm sitting here with a 3-year-old boy, still struggling some days to keep my head above water because of maternal mental health. And what it makes me stop and, kind of knocks the wind out of me is when I'm asked to speak in a situation like this. And so many of you are working with people that don't have all the tools. And when I think about how frightening and terrifying and scary our journey has been for so many reasons, it breaks my heart how many people are going through this without all the tools, and how much harder that can make a situation like what I'm about to tell you. So again, my name is LK Johnson. I am a Hickory native. I am 36 years old and happily married to my husband, James. He's from Indiana, and convinced him to stay here with me. So after we were married for about 4 years, we decided to start trying to grow our family. And we really didn't have much luck. I had suspected years ago that I was suffering from endometriosis. And, we just ran into some problems getting pregnant. It ended up taking us 4 years and 2 rounds of IVF. And we got one perfect embryo, and that was our son, James. I was released from my IVF doctor and turned over to the hands of my OBGYN, monitored. Just a side note too, this was all going on during COVID. This happened in 2020. So it was a wild experience. I often laugh when I tell people my husband wasn't even in the room when I got pregnant. My IVF embryo transfer, he wasn't allowed in the building. So I was in a room full of women. So, COVID has definitely brought an interesting curveball to this whole story. But yeah, we got pregnant, turned over to my OBGYN. I did end up getting COVID at 8.5 weeks, which was terrifying because at that point, there was no information on how it was affecting first trimester moms. We knew where they were in terms of third trimester and second trimester. I think at that point, we had seen some second trimester deliveries from moms, and everybody was hopeful, but we were still waiting on a lot of information. And as hard as we fought to get him, it was really hard to be in those circumstances. The impact that had on my mental health was tremendous, because when you are looking at the people who are supposed to be reassuring you and you're getting, we don't know, that's just not ever what anybody wants to hear. Thankfully, I seem to get through COVID with no issues other than my effect on mental health. And then I had a relatively normal, what they would call perfect, pregnancy. Things were progressing as they should. And then around 24 weeks, we had to go back in for a repeat anatomy scan. Because my son was an IVF baby, you're automatically categorized as high risk. So they sent us to maternal and fetal health at Catawba. And I'm going to take a sip of water, allergies. So they sent us to Catawba, 24 weeks. It was supposed to just be a very routine follow-up of my anatomy scan. And shortly after getting in there, she starts to turn the ultrasound on, and we're taking a look, and you can always tell, you don't know until you're in that situation, but you can always tell, like, when they're not looking at what they want to see. And so she asked if my back was hurting, and I said, well, I'm pregnant, my back always hurts. So I was instructed to not get off the table and to put on a gown, and that they wanted to do some internal monitoring. We were going to do an internal ultrasound, the transvaginal ultrasound. And as soon as the wand went in, we could see that his foot was, I mean, right there. So at 24 weeks and 5 days, I was admitted to Catawba with a double footling breach. And that means that both of his feet had broken through into my cervix and were hanging down into my cervix. I was 4 to 5 centimeters dilated. And because of how far along I was, it was irreparable at that point. I mean, we were literally gravity and pray. Within 10 minutes, I am upstairs in a bed, IVs going in both arms. They're laying paperwork on my lap to consent for a blood transfusion for myself and my son. And without the words even being said, it is crashing down on me that my son is going to be born sooner than later. And that was a terrifying thought. I wasn't even close to my 3rd trimester at this point. So I was put in Trendelenburg, which means that I was tilted back on my head and put on a magnesium drip, which is, it's like if you went into a sauna and then got in a pool of hot sauce, like it just whole body on fire. But the point of this drug is to prevent brain trauma for the baby and to help protect them, and also to help stop labor. So I made it 8 weeks, tilted back on my head, and I am talking, or excuse me, not 8 weeks, 8 days. I made it 8 days, tilted back on my head, not even getting out of the bed to go to the bathroom. Just like I said, gravity and pray. And we were thankful to have the amazing support of our family on the outside. Yet again, this was COVID. Thankfully, at that point, my husband was allowed to be with me, but no family. And this is a terrifying experience to go through when you've got everyone by your side. It's a lot to try and grasp when you're in the midst of like experiencing trauma. So we made it 8 days, and I am so thankful that the doctor that was on call that morning, she was our favorite. She's who we wanted. You know, we said back when I was pregnant and we met her, if it all hits the fan, we hope she's the one with us. And when I tell you that it hit the fan hard. And I'm so thankful that for this doctor, because here again, I had all the tools, and I had the doctor that was watching out for not only that baby, but for me, not just when he was brought into this world, but after. So my son was born on December 8th, 2020. He weighed 2 pounds, 1 ounce. I called him my tiny but mighty from the get-go. You know, your body has a crazy way of protecting you from what you're actually seeing. You know, shock definitely sets in. It was, I believe, 9 o'clock that night before I was stable enough to be able to go upstairs to see him. I had been tilted back on my head for 8 days. You would not believe how fast your muscles atrophy. I mean, I literally just couldn't even hold myself up whenever they were trying to put my epidural in on the OR table. I was literally like passing out from my vestibular response. Like my body was just not having it. So it was a long time before I could get up there and actually get to see him. And it didn't occur to me until all of this was over, really the depth of the emotions that I was experiencing. You know, here I am, a first-time mom, and all of the experiences are just getting pulled away from me. I mean, holding your baby for the first time, you know, when your baby comes out, you know, typically, you know, everybody in the room is, oh, the baby's here. And it's this very happy response. And instead, for me, it was quiet. They don't cry when they're that little. And instead of congratulations, it's a boy, you get your baby has been successfully intubated and is on the way to the neonatal intensive care unit. And, the first thing that I'm thinking is I'm looking at my husband and I'm like, get out of here. As a mom, you're like, get out of here. I'm fine. So there are so many layers to this. You're getting robbed of these experiences and you're grieving the loss of a baby shower, of something that just seems so simple. But like that, it's all just taken. And it's a really hard thing to experience while you're continuing to go through ongoing trauma. So he was born at 25 weeks and 5 days. We served 120 days in the NICU. About a week after James was born, we were notified that he suffered 2 brain bleeds shortly after he was born. One was a grade 3 brain bleed and the other was a grade 1 or 2 brain bleed. So before we were able to go home, James had to have surgery. He had surgery when he was a month old at barely 3 pounds. He had another one 2 weeks after that. And then the night before we were supposed to go home, I was staying at the hospital, and boarding is what it's called, where you go in for your education, basically, before you go home. And at 2 a.m., my son had a bradycardia episode in my arms, and he stopped his heart and quit breathing. And we went from you're going home tomorrow to you're going back to Levine's for a 3rd brain surgery. And here again, when I tell you I had all the tools, I had parents that without question booked us hotel rooms in Charlotte. We didn't have to go through things like applying for the Ronald McDonald House. All of these sources, all of these things, gas to get down to Charlotte and back if we couldn't afford to stay down there. You're talking about families often who are not near a level 3 NICU like we are at Catawba. And that means that they have to drive an hour, 2 hours daily if that means that they want to see their child. That should not be the reason. It just shouldn't. And the fact that gas is part of the reason that these people aren't able to make these journeys, people can't take time off of work. It's terrifying. My husband had the most supportive employer we could have asked for without question. He was able to work from home, be with me and help us. We had all the tools. And when I tell you by the end of this, we were billed, or not that we were billed, but like our son's medical bills were well over $1 million. Granted, thankfully that's not what we paid because of something like SSI Medicaid. But again, not everyone is notified about SSI Medicaid. Not all social workers in NICUs feel the need to help families apply for SSI Medicaid. There are people getting out on the other side that didn't even know that was an option. And that, it's a crime. It really is. So we brought our son home, and ever since then, we've been navigating life after the NICU. And once you come home, things really don't stop. We had a cardiologist, a allergist, a neurologist, a neurosurgeon. He had an ENT. All these specialists and all these appointments that you're still having to go to post NICU discharge while navigating the fact that you've had this child in a bubble for all this time, and then you've brought them out into the world. This is not your standard mom's nervous about bringing baby out. This is in the middle of COVID and germs. And I had so much support and help in driving us to appointments, things like as simple as making sure like we had dinner that night or that our dogs were let out. Things that were helping me decrease my mental load so that I could be where I needed to be. the burnout in these moms that don't have that help is staggering. I was so lucky to have a physical therapist for my son. She sees him weekly, and guess what? That means that she is checking in on my mental health weekly. And if she thinks for a second that something's not okay, she doesn't hesitate to ask me about it, to suggest to my husband that he check in on me about it. She texts me throughout the week to make sure that I'm okay, that I'm getting what I need, that I'm getting the reassurance that we're headed in the right direction for my son. Because of his brain bleeds, he was really high risk for cerebral palsy. I'm happy to announce that we've been hopefully cleared of that. We've worked insanely hard physical therapy, but that's also because I have turned our house into a therapy clinic because we had the finances to do so, and not everyone has that. And I don't necessarily know what the answer is, but I know that I can be here to support those moms so that they're feeling heard and that they know that they're not alone. Because I feel like identifying, this is step one. But he's 3 years old now. He goes to preschool several days a week. Per the recommendation of his neurosurgeon, socialization has been one of the best things for him. We work hard every day because while he's been cleared of cerebral palsy, he still can't run because we've been fighting for diagnosis for something that's been going on with his eyes. The lists are endless of what I could go into in terms of the things that you encounter after the hospital stay. One of the things that like flies all over me is when people are like, oh, okay, but he's okay now, right? And I'm like, yes, in that, we're not at a mortality risk right now, but there's still a lot of work to be done. And still, while that's going on, mom's on Zoloft with no expectation of coming off of that anytime soon, because again, I have had women in my life championing how important mom is and how important mental health is. And without those people in my life, like I wouldn't be where I am. My son wouldn't be where he is. Because again, there are still days with all that help and all that support that I'm struggling to keep my head above water. So yeah, that's a little bit about our story. Anybody have any questions or anything that I didn't touch on or anything about his story further that you'd like to hear? I'm happy to answer.
Okay, is it okay if I share that picture you shared with us of you and James?
Yeah, absolutely.
I just wanted to share because he's so handsome.
That is my little munchkin.
We'll open it up. Are there any questions for LK? She said earlier she's an open book and she'll answer anything.
Yeah, I'm happy to answer.
I have a question.
Yes.
So in one of my trainings, I had I think she was a nurse, and she had a NICU baby as well. And she mentioned that one of the support systems that was at the hospital was the clergy. But other than that, just as far as like emotional support, that wasn't really there. And she pointed out, like, if someone isn't practicing like religion or aligned with the faith, they're kind of like left to the wind. So could you speak a little bit about like what supports were like at the hospital as far as emotional support?
Yeah, so she's not wrong in that. And not wrong at all. I mean, there are bulletins and things posted, but I would say that my biggest like support emotionally would be my lactation consultant. And she's, you know, Jackie, who's at Catawba. She would come by and check on me, you know, every day. But then there again, like if you're not checking the box, like if you don't align with this religion, or if you're not, you know, pumping or breastfeeding or whatever, like what are your resources? And, you know, thankfully, the nurses there are like angels on earth, and they really, really pick up a lot of the weight. I would say, you know, I always laughed that like they don't just get the baby as a patient, like they get the whole shooting match. Like they get, especially mom, you know, because mom's kind of navigating those hormonal drops and emotions, you know, at this time. So I would just say, you know, the nurses are probably like the biggest source of support. Unfortunately for us during COVID, the only support groups that were going on were virtual, and they weren't necessarily localized like to the area, but a lot of the support stuff had been shut down because of COVID. And as I understand, I don't think that I know that they haven't gotten a support group back up and running, and that's actually been one of my big things that I would like to get going. I've been talking with Jackie, who's the director of the Women's Center, about starting a support group, and we've gotten permission from the pod where they do all of the education downstairs in the Women's Center, to use that. And I'd love to do something like once a month, and do support group meetings for parents of NICU babies. And that way, especially when there are families that are currently in the NICU, they don't feel like they're having to step away from the baby to go make it somewhere for a meeting. You know, I want to make it as easy as possible for them to, even if it's just to come in and say like, hey, I'm feeling this way. Like, can you relate? So that's been a really like important thing to me. And that's still kind of a work in progress. We're still ironing out some details, but I can definitely, hopefully once we get that up and running, reach back out to you guys to let you know that that resource is there, because it's not enough. Like, you know, as I showed you or told you guys with everything with us, like it's still just not enough. And one of my best sources of support is being connected with other moms that have been through this.
Definitely. Thank you.
Yeah. The amount, I would just like to note, I think I touched on it briefly, but like not getting to hold your baby, not getting to experience a baby shower, like they seem like little things, but when you look at the fact that I was 25 weeks, I mean, I was just over the halfway point. Things like getting to hold your baby for the first time. I didn't get to hold my son until he was 8 days old. And even then, he was hooked up, you know, to all kinds of machines. And we were more scared than anything. You know, of course, you're like happy you're holding, you know, your baby, but he had gotten down to 1 pound, 11 ounces at that point. So it was, it was beyond overwhelming to finally be holding him while processing that you're like meeting your baby and touching your baby for the first time. My husband loves to watch the video because my head is crying and like my head is shaking, but my body was still, you know, I was trying so hard, like not to shake him. And, you know, something as simple as when I went to go search for dresses for my baby shower, I went, hopped online, baby shower dresses, and boom, it smacks me in the face that I'm not pregnant and I don't need a maternity dress. And that's hard for somebody who's, you know, spent 4 years trying to get pregnant and who wanted this like so bad. The amount of grief while you're still trying to like navigate taking care of this new baby it's beyond overwhelming. I think there was a question that came through Maybe I'm
Yeah,
not
in the chat, Shelby asked, in a perfect world, what would emotional support look like for women in women's centers and NICUs, etc.?
I think that they should have some type of mental health person, like specifically for women's center units, that would cover the NICU, that would cover maternal fetal health, that would cover labor and delivery. Like, you're dealing with some really traumatic situations. I often heard from the nurses, everybody would come in and say, like, you're so easy to take care of. Like, this is so great. Like, they often have patients who have really severe, like, mental health issues, who are, fighting the care that they're trying to give them because of a mental health disorder that has taken over. So ideally, I really, really think that every women's center should have some type of mental health expert, like, on call, that would be in close touch with all the OBGYNs that are practicing through that hospital, so that it is second nature to pick up on something and explain it to the doctor. I find it staggering that by the time a baby is 1 year old, that they have like 7 or 8 doctor's appointments. Guess how many mom has? 1. And that's to tell you that you can have sex. And I don't really think that that's what we need to be prioritizing. So, any other questions?
Thank you so much, LK.
Yeah.
I will note, when we plan these cafes, we plan the topic. We don't plan any coordination of what the two speakers may be speaking to that provide such a direct connection to each other. Because if you look back at the things Amani was discussing in the 8 dimensions of health, LK had no idea that was what she was speaking about. And yet, if you listen about the things she spoke about, intellectual, emotional, social, occupational, financial, environmental, physical, and spiritual, were all things that LK touched on, either directly or indirectly, while she was talking about her personal experience. And I think that is such a powerful connection, because that was not planned. It happened very naturally. And then, the other connection, Amber put in our chat box, our trainings. I really encourage you all to look at the trainings that Partners offers, Amber's team, which Amani, you're a part of, and look at the different trainings we have to support. Now, they're not going to meet the needs of LK in the situation you dealt with there. And I think that is a gap that needs to be looked at. But as a general thought, we offer a lot of support for a lot of those 8 dimensions of well-being and health that are noted there. If there's no other questions, I'm going to turn it over to Amber. And thank you all for being here. I think this was such a powerful presentation today for both Armani and LK. We greatly appreciate your being willing to speak.
Yes, I want to echo that. Thank you both so much. Okay, thank you for sharing your personal story. We all, if we're not a mom, we know moms, or we have a mom, right? So just remember that, these situations are not isolated or selective. They happen to everyone, and it's unexpected sometimes. And some of the biggest things that we can do is continue to support the mothers in our life, even after, as OK mentioned, even after the birth and the medical needs are met. There's still a lot of emotional and spiritual stuff that goes along with that. So thank you both again. I want to put a plug in for next month's Community Cafe. It will happen on June 26th from 10 to 11. We are going to spend some time talking about tailored plan in general and that transition with Medicaid on the state level, and specifically how tailor cared management can help people in the community in general, and how they can live healthier lives and also have a really positive impact on their communities that they live and work in. So look forward to that. And thank you guys again. If there are no more questions, I hope you have a great rest of your day. And thank you all for being here.
Thank
Thank
you.
you guys.
Thank you.